Hi everyone, welcome back to another episode of Ask Dr. Nick. My name is Dr. Nick Schmidlkoffer and I work for the Neurologic Wellness Institute. And today's question is, what does gravity have to do with irritable bowel syndrome? Or what is the relationship between gravity and the gut? And I think this is a really interesting topic proposed in this article that I'm going to share, because gravity is something that we are thrown into when we were born, right? I talk about this a lot with patients when it comes to how we have to defeat gravity in our first year of life. While we're in the womb, in our mother's womb, we are in this like gel-like structure that gravity doesn't really affect us because we can move and twirl and turn as much as we want. When we're born, now gravity has this like pressure down against us. And in order for us to move and to get what we want and to explore the environment and toy with the environment around us, we need to defeat gravity by rolling, by then getting up on all fours, crawling, and then eventually standing on 2 feet and walking. And this generally takes about a year to a year and a half to complete. And this is how gravity is the first sense that is so important for us. And to me, it's kind of the foundation that every other sense builds upon. Every other sense, whether that be the sense of vision, the auditory or hearing, touch, and proprioception in our muscles and joints, but also gravity we also have sensors in our gut, and we have to be able to have gravity as the foundation for the sensors in our gut as well. So we're going to get into this paper. It's a review article, and we're going to get into this paper and just talk about this proposed mechanism of how gravity and how maybe the brain and the gut not being able to handle and take on gravity as an explanation for irritable bowel syndrome. And of course, irritable bowel syndrome, or IBS, is basically a type of gut abnormality that may be also related to the brain, causing constipation, diarrhea, bloating, other digestive issues, possibly pain in the abdomen. So let's get through this here. Here is the paper. Again, it's a review article. It is called Gravity and the Gut, a Hypothesis of Irritable Bowel Syndrome. It is by Brennan Spiegel, and it is in the American Journal of Gastroenterology in 2002. Okay, so real quick, we'll just kind of touch on the abstract. He talked about the pathogenesis of irritable bowel syndrome, which is this disorder of the gut-brain interaction that affects up to 10% of the world, is still uncertain. We don't really know the pathogenesis, but there's this generally a unifying factor that binds many theories for irritable bowel syndrome, and that is gravity. And so he says, in short, the hypothesis proposed here is that IBS may be a result from ineffective anatomical, physiological, and neurophysiological gravity management systems designed to optimize gastrointestinal form and function, protect the somatic, so basically body, and visceral, more gut, integrity, and maximize survival in a gravity-bound world. Okay, so he says we're going to review the influence of gravity on human evolution, discuss how Homo sapiens imperfectly evolved to manage this universal force of attraction, and explore the mechanical, microbial, and neuropsychological consequences of gravity intolerance, with the focus of explaining how that relates to IBS. Okay, so let's just go. He has so much in this paper, and it is a very good paper. I suggest anybody to look at it if they want to learn more information. I'm going to touch on like the bare bones of it. So he says gravity is going to affect all these different systems: the gastrointestinal system, the cardiovascular system, the musculoskeletal system, because of course we have to use our muscles and joints to defeat gravity, and then our vestibular system, which is in our inner ear, telling us where our head is in space, whether it's upside down or turning or whatever that may be. He says we have 3 different forces that are relating to gravity. We have G-force resistance, so basically how do we resist gravity? we have G-force detection. How do we detect gravity? And then we have G-force vigilance, or how is our ability to perceive gravity and utilize it, or basically vigilantly adapt or adjust to gravity changing. Okay, so let's first talk gastrointestinal in this G-force resistance. So we could have altered transit, altered movement, or stasis of the gut, because again, gravity is pulling down. Generally, our gastrointestinal system goes from mouth to anus, going down with the help of gravity. But there are some areas that do have to push against gravity. How altered microbiome can be affected with G-force resistance. Gas, pressure, wall tension. So basically, when we have gas in our stomach, gas wants to rise against gravity, versus when we have a lot of food in our stomach or abdomen, that's going to get pushed down or pushed against our wall, our abdominal wall. That can lead to more bloating and pressure. Immune dysfunction, altered defecation, right? Altered ability to defecate. Cardiovascular, gravity affects cardiovascular system with orthostasis. So basically, people with POTS, or postural orthostatic tachycardia syndrome, are more likely to have IBS. He goes through this whole mechanism. And there's also a relation with EDS, or hypermobility, Ehlers-Danlos syndrome. And so POTS, EDS, or hypermobility, and IBS are very one of these like correlative diseases that come together. And so that's why here again, gravity and cardiovascular system could be how gravity could play a role on both cardiovascular system and gastrointestinal system to cause both POTS and GI issues. So orthostasis, so the ability to be able to go from laying down to standing up, gravity is going to be pushing blood or fluids down. And so therefore people may feel better laying down, but then when they get up, they have to defeat gravity. Their brain's ability to get blood flow, their body's ability to get blood flow to their brain might not be beneficial, and therefore that may affect how the brain is controlling the gut through the gut-brain axis. Musculoskeletal, right? We have different stretches and pressures that are pushing with gravity pushing down. So when we have to bend over, different muscles have to work. At the same time, different muscles have to stabilize the spine to be able to act as like kind of a linchpin for the gut, for the intestines, for the stomach, which are attached mostly to the rib cage, the diaphragm, and the lumbar spine. And then vestibular, which is again more of the inner ear. You have this structure which has semicircular canals, otoliths, and a cochlea for hearing in your inner ear, and basically the endolymph fluid within that is going to move, and it's going to be adjusted or changed with gravity. So we do a lot of work with the vestibular system, which can help a lot of these other problems. So there may be problems with just the general resistance, right? So the stretch of tissues, if again people are hypomobile, the stretch of tissues are more elongated, and therefore it can change how well we can push stool or push a bolus of food through our intestines, right? But it can also affect all these other systems. With G-force detection, right? So we have to be able to properly detect the gravity, but then at the same time, our brain needs to then be able to integrate that to do things. And so with G-force detection, we have afferents, so basically sensors in our neuron sensors in our viscera being gut and abdomen, that can cause maybe abdominal pain, abdominal butterflies, cramping, bloating. Speaking of abdominal butterflies, he mentions how it's pretty simple to compare gravity to the gut, because everybody has experienced butterflies in their stomach. A lot of times people feel butterflies in their stomach when they are like falling in love, when they're anxious or nervous, okay? But almost everyone has been on some roller coaster or something where they may start like falling, and that drop causes like a drop in their stomach or an abdominal butterfly, right? They may feel like they're going to fall and boom, or this rush of energy, and that causes this drop in their stomach or pit in their stomach. Okay, that's how we know that how highly gravity plays a role in our gut-brain axis and affects our visceral afferents. Okay, baroreceptors. So in our cardiovascular system, we have baroreceptors that sense pressure, basically pressure in our arteries. And so what this can do, the sensations, if baroreceptors aren't working well, lightheadedness, palpitations, tremor, fatigue. We have neurons that are in our muscles that are sensing joint pain, muscle pain, fascial pain, body aches, which again, gravity are kind of pushing or stretching against. Our hair cells that are sensing gravity in our vestibular system may lead, if it's a dysfunction, may lead to disequilibrium, vertigo, nausea, vestibular migraine. Okay, and this is how, again, nausea, vomiting is also a visceral symptom as well. So that's where that can come into play. And then lastly, G-force vigilance. So again, G-force vigilance is how the brain is utilizing the G-force. So we have kind of visceral anxiety, which means that people just in the fact of they know they get pain with eating certain foods, then they're going to have pain with eating those foods or get pain with eating in general, because how their gut-brain axis is wired plastically to cause anxiety with visceral issues. Okay, and so if the problem is with how our brain is integrating gravity, might actually affect anxiety for the visceral system. Somatization. So basically, somatic G-force vigilance. Some people, they are always in pain, that they are more susceptible to pain, and that can lead to somatization. Devitalization or gravity exhaustion. It's another one. People that are that somatize a lot of times catastrophize. Basically, with like cognitively, they say that their pain is worse than it actually is, because not because they feel it, but they have a sense of feeling it in the past. People that don't have a good job of sensing gravity, integrating gravity, may feel like they have a lack of control of themselves. Lack of control then can also lead to anxiety. And then because of that, they may have healthcare seeking behaviors where they're constantly seeking out more healthcare to help them with their random problems that are all across the board, but it may be a true gravity problem where their brain is not sensing gravity well. And then they also may have avoidant to restrictive behaviors, again, avoiding certain things that they know is going to cause them issues, when really it's a gravity issue. So I know that's a lot. What this doctor talks about here is then if we look at these three combinations, G-force detection, which is more peripheral nervous system, G-force resistance, which is the actual structures in the tissues like the gut or the muscles, and then the G-force vigilance in the central nervous system. Okay, if people are basically very durable, G-force resistance, they're normal sensitive, they don't have excessive sensitivity, and they're kind of unconcerned with life in general, they're very calm, then they are going to have a very low IBS risk. Whereas on the other hand, if they are more hypersensitive to detection of many things, hypersensitive detection of gravity, they're more vulnerable to G-force resistance, as in they have more stretch, like in the hypermobility POTS scenario, or they are hypervigilant, they generally have more anxiety. They are hypervigilant to changes in gravity, like they don't want to sit up because they feel like sitting up is going to cause them more issues. Then these people are very high risk for IBS. They're hypervigilant, hypersensitive, and very vulnerable. Okay. He has a lot of other great pictures describing how gravity is kind of pulling our GI system down. He has other figures talking about again, like our backbone system, and then same thing with the gaseous distension and causing more bloating and pain. And he also talks a little bit about like serotonin and the microbiome. But I just want to talk about his table here at the end. And so his table at the end is very good when it comes to talking about possible treatments that we can do for each of these factors, right? And so we kind of talked about each of the set points, okay, and the natural variations that can occur. Factors that can affect these set points, right? Sedentary lifestyle, lack of exercise, just age-induced weakening. For G-force detection, gut inflammation, you could have had an infection. Modifiers to serotonin in the gut, because serotonin is highly produced in the gut microbiome could be off. Changes in cortisol or the HPA axis. G-force vigilance, so more again central nervous system, brain. Early adverse life events, post-traumatic stress, disordered sleep, again HPA axis stuff, psychological problems, all are things that can set off the resistance, the detection, and the vigilance of gravity. And so we need to clinically assess them, but then potential treatments that could all help with IBS because of gravity is aerobic exercise and core workouts, weight loss, Tai Chi, acupuncture, yoga, massage therapy, manipulative therapy, so a osteopathic manipulation, a chiropractic adjustment, various varying sleep positions, tilt table therapy, which is what we do in the office very often for patients with POTS and dysautonomia. Treatments that shift away from sensitized toward a normal sensitive system. Modify the gut microbiome with like a low FODMAP diet, or maybe possibly antibiotics are needed, probiotics might be needed. Altering the gut serotonin levels, the peripheral nervous system neuromodulation, so possibly medications to affect that. Vestibular treatments, again, we do a lot of vestibular treatments for these patients, and then increasing hydration, salt intake. And then lastly, treatments that shift away from the hypervigilant ones, right? Cognitive behavioral therapy, other psychological therapies, meditation, deep breathing, maybe some clear medications, vagus nerve stimulation, sleep therapy, all things that might be beneficial for patients with IBS if we attack these specific scenarios, whether it's the peripheral nervous system and the sensors, whether it's the abdominal contents and just general resistance to gravity, and then lastly the brain, the central nervous system, and how that can adjust or react and help with patients with IBS. So I hope you find this one interesting, because there are a lot of people out there suffering with gut and abdominal complaints, especially IBS or irritable bowel syndrome. And so I hope this shows a little bit extra influence on how it's not just a problem with the gut, that there are other things that might be going on, especially with how the central nervous system integrates gravity around us, and how we can then defeat gravity, not only with the central nervous system, but other strategies through resistance and vigilance, and the last one, as I forgot now, the detection. So if you have any questions or comments, please leave them below. If you have any suggestions for future topics, I would love to hear them. Thanks again, and have a great day. Stay healthy.